Welcome everyone to week 1 of pharmacology. I'm so glad you're all here. Um, I like that smiling faces. Excellent, excellent. So when you have questions, please just ask them. All right. And this is going to be our only pre-scheduled Zoom for this class because it is only a 1 credit hour course. But with that said, at any point, you can email me, and if you want, I can schedule one for the whole class or even just a one-on-one Zoom or a phone appointment, or we can email back and forth, whatever works for you. Okay? I just want you to know that I'm here 7 days a week in the class and in my email, so I'm here to help you. The first thing that I want to do is explain to you why you have to take this course. Okay, we're not looking to make you into pharm techs or pharmacists. However, as medical coding professionals, you will have to interpret patient records. And you will have to identify those times when a patient is administered a medication by a healthcare professional, and you will have to code it. Whether it's just the HCPCS level 2 code, a J code, or another code for the medication itself, for a CPT code for the administration of that medication, or anything else. For example, you might be interpreting the medical records of a patient who had a procedure notes, and the patient was given Versed. Do any of you know what Versed is or why it's used, how it's used?
It's used
Oh,
for
good.
anesthesia.
Huh?
It's used for anesthesia.
Well, actually,
Parts of it.
yes. You're very close, Cindy. Good job. Actually, it's used for conscious sedation,
Right.
which is different than anesthesia. Anesthesia puts the patient out so that they don't feel anything. Conscious sedation is actually an anti-anxiety medication that calms and relaxes somebody. So even if you feel a little something, you really don't care. Okay. It's used for conscious sedation for procedures that are not expected to hurt the patient, but they might be anxious about it, nervous. And we certainly don't want a patient to be nervous for the psychological reasons, as well as you don't want them moving around a lot during the procedure because that could cause trouble. Okay. So if any of you have had or know somebody who's had a colonoscopy, for example, that is usually conscious sedation that's provided to the patient in most cases. So this is why you need to touch upon pharmacology in your learning. Okay. So when you're reading and you identify the name of a drug, you can then check it out and determine whether you need to code it or whether it's not of consequence. Now, remember, we do not code the medications where the patient is given a prescription. Okay. Those are any medications that are taken self-administered by the patient at home. We don't code that. Okay, only when a medication, a drug is administered by a healthcare professional. Okay, does that make sense? We're gonna go with yes, that makes sense. Give me, thank you very much. Okay, good.
Yes.
All right. See, I don't ask a lot. A little nod, a little, you know. Okay, so this is module 1. Now, you know this is a 16-week course, but it's only 1 credit hour. It's still important. So, as I said, the workload should not be too heavy for you. You're going to have your discussion board and you'll have some quizzes. You have to read the chapters, but it's like one chapter every 2 weeks. You know, it's not a big burden. All right. And remember, I am here for you to support you. So this week, make sure you review the syllabus, make sure you review the calendar of topics and assignments. One thing that I don't like about this way this course is structured is that it's not a weekly thing, okay? Because I find that harder because you're not building that habit, okay, every Thursday or whatever it might be. I want you to build the habit to come into the course every week. I want you to build the habit of really reading the chapters, okay? It's not meant to put a lot of pressure on you, but as I said, there's still good, valid reason why you need to learn this stuff, okay? All right.
What are we supposed to post on the discussion board? I don't understand that.
Each week, each discussion board, you have a question, you have a prompt, if you will, that's going to ask you a question or talk about a topic, and then you have to research that and you have to talk about that topic, okay? I would prefer you to use this opportunity to learn, and that means don't just copy and paste from somewhere. Don't just respond with, I have no experience in this, I don't know, because that just is a waste of your money. You're here to learn, and I take that very seriously, okay? So use the opportunity to learn something, use sources, cite your sources, and use the discussion posts as an opportunity to reinforce that learning by having to put it into your own words, okay? But I try to make them not too heavy, and a lot of them are based or in coordination or align with your reading. So you have your textbook information, but I'm also, and this is one of the things that yes, that I want you to pay attention to, and this is being recorded and I will post it in the announcements. These are helpful resources that can be trusted. They will give you reliable, credible, trustworthy, accurate information. You know, the internet has millions and millions of websites, and a lot of it are people who are talking about stuff that think they know stuff, but they don't know anything. They just make it up. I don't want you going on an interview. I don't want you sitting for a national certification exam with your head filled with my grandfather's father's uncles, cousins, friends told me this, okay? I want you to have accurate information. So the first one that I want you to bookmark or make a favorite, whatever browser you're using, is this medications index from MedicineNet. It gives you the opportunity to look up the different types of medications. You might want to use this in your own personal life as well to check out if a physician prescribes something for you. In addition, you know, a lot of people are very big on herbal remedies and don't realize that herbal remedies can harm you as well. So you have a personal stake in learning this in addition to the career advantage, okay? And as I said, I will be posting this for you, and you can always email me and say, what was that again? Okay, drug index A to Z at www.drugs.com. All right. You can look up any medication by their proper name, their trade name, or by their generic name. And you can find out about adverse reactions. You can find out why the drug is prescribed, when the drug should not be prescribed. That's called contraindications. Contra meaning against, indications meaning the reason why you would prescribe this. So contraindications are situations, conditions where this drug should not be provided. And remember, you have access to this information. You want to be the smarter patient. And what by that, because, you know, I love my doctor, my primary care physician. I do trust him, but he's human and humans make mistakes. And many, many years ago, I went to my doctor an emergency because I wasn't feeling well. And so I had to see not my regular guy, but one of the other partners. And it was a Saturday, and he just kind of flipped through my chart. That was back in the days of paper charts. That's how long ago it was. And he prescribed amoxicillin for me. Okay. So I went from the doctor's office to Walgreens, you know, the pharmacy, to have it filled. And then I brought it home and I put one in my mouth and I swallowed it. And then I'm looking at the insert and I'm looking at the name. And I went, oh. So I picked up the phone and I called the pharmacy to talk to the pharmacist. And I said, this is amoxicillin. Is this a derivative of penicillin? And the pharmacist said, yes, it is. And I said, well, I have a problem because I'm allergic to penicillin. My arms were already breaking out in a rash. So the pharmacist contacted the doctor, got a change in the medication for me, and I was able to get replacement to take care of the cold or flu, whatever it was that I had, and I didn't have to suffer an adverse event. So it's really good for you to be watching out for yourself and your loved ones. Okay. All right. The next one. Medline Plus. MedlinePlus.gov is one of my absolute favorite websites for all things medical. And they have great articles. It's written in a way that anybody could understand. So it's not written in medical jargon, it's written in regular English. It is created and maintained by the National Library of Medicine and the National Institutes of Health. They have videos and they have fabulous illustrations, and they cover everything from signs and symptoms, diagnosis, tests, treatments, everything. It is wonderful. And this particular link will get you right to their discussion on medications. Okay. Very, very informative and helpful. And again, trustworthy and credible. Okay. All right, and the FDA at www.fda.gov. Lots of information because they are the people who approve drugs, medical devices, all kinds of things. This also will give you the basic information about the medication, why it would be prescribed, off-label. Do any of you know what off-label prescriptions mean? Okay, good. See, look at this. We're only together 10 minutes. I'm already getting to teach you two things. All right. Off-label means that the drug may be known to be beneficial to someone with a diagnosis that is different from the diagnosis the medication is approved to treat. Okay, so for example, you might have a drug that is approved to treat hypertension, okay, chronic high blood pressure. But they may have found that it also helps people with anxiety. I'm just making this up for the example, but so if the same drug was prescribed for somebody with anxiety who did not have hypertension, that would be an off-label use. It is not, how do I say this? It is not a good thing because you don't have the protections of the rest of the research on the medications. However, it is done all the time, and it is usually listed in the information for the medications. Then you'll also have, as we discussed before, contraindications, and as well as adverse events and things like that. Okay. Any questions so far? That's because you're also smart, or is because I'm a brilliant teacher? Or both. That's it. It's both. I knew it. I knew it. Okay. So now I just want to show you how to interpret what you're looking at. Okay. So and you'll need this for coding as well. Okay. Azithromycin, and you can see this is the generic name. It also gives you, you see that little speaker with that if you click on that, it will give you an audio as to how to pronounce the medication. Okay, which is important because you're getting ready to go out into the industry. At some point, you kind of have to talk to people. And I'm not talking about your patients necessarily. I'm talking about other healthcare professionals. You want to make sure that you can communicate in a fashion where you can be understood. Okay. Then it will list the brand names. Okay. So you can see that Zithromax, a Zmax, a Z-Pack. Some of you may have had that if you had an infection. Are all listed there. So this can help you if you if the physician's documentation has identified the medication by the brand name or the generic name, and that's going to be whatever they're used to calling it. Okay, you can still track it down to get the information that you need. Now, sometimes the code books, which might be your diagnosis codes, ICD-10-CM, and it might be CPT book, or it might be HCPCS Level 2 book. They may list the drug in the generic name. They may list it by brand name. They may also list it by category. We're going to get to that in a minute. Okay. You also see here that you will get information on the following strengths. These are the strengths that the medication is produced and provided by. So you can see here you have 500 milligrams, 250 milligrams. That's probably going to be a tablet. Okay. But then you see later on, I'm pointing, and I know you can't see my hands, but okay. You see later on that same line, you see 100 mg/5 ml. That's 100 milligrams per 5 milliliters. That's telling you that that would be an IV, intravenous administration of that medication. Okay.
Could it be PO?
I'm sorry.
Could it not be PO also? Liquid?
That
Oral?
no. Well, unless it's available as a suspension, but something like this usually is not in a suspension. It would say suspension.
Okay.
Okay. But it will specify later on in the information, whether it's a tablet, a caplet, a capsule, a suspension, liquid form, whatever. Okay. Good question. All right. Then this it goes right to what you were saying. You can see here they will list the brand name and the generic. And you see here, this is a packet oral. And you see cherry banana flavor, that is going to be a liquid. Okay. Because, you know, the pharmacy does that for kids. All right. And then on the right side of your screen, you see tablet oral. Okay, so that is going to be later on in the information. This information is going to be long. Okay, and if you get a prescription or know somebody, this is also the same information that's on the insert that comes with most medication that nobody ever reads. Now you can read it and know what it's talking about. Okay, labeled prescribing indications. This is what I was talking about before. It's going to explain to you, you have your diagnosis, cancroid, and treatment of genital ulcer disease, or you might have otitis media acute. Anybody want to tell me what that is? Come on.
Ear infection. Ear
Yes.
infection.
Middle ear infection. Severe middle ear, otitis ear, media, middle ear, acute, severe. Okay, so you can see, and this is explaining the diagnosis and how it is used. And this is very important for you to know, again, not only as professionals, but as people. I'm assuming you're all people. Robots? No. Okay. All right, so you notice that it says here, treatment of acute otitis media due to H. influenzae, M. catarrhalis, or S. pneumoniae. So what those are specific pathogens that cause infection. And if you remember in your anatomy physiology class, or maybe in your diagnosis coding class, you learned about infectious diseases and all the different kinds of pathogens. Do you remember that? You have bacteria, you have virus, you have fungi, and you have parasites. We don't like those. Okay. All right. So this is important because it shows that, especially before a medication of this nature is prescribed, the blood work has to be done to determine the specific pathogen. Because you know that an antibacterial medication is not going to work on a virus, and an antiviral medication is not going to work on a fungus. Okay, so you can see here that you need to know specifically what is causing the infection to make sure this medication is going to work. Okay, this also gives you a little hint as to why there are 5 different antibacterials. Why do we have 12 different brands of aspirin or things in that category? And then you have aspirin, you have Tylenol, which is acetaminophen. Then you have naproxen, right? Those are all different formulations of essentially the same thing, an NSAID, which is a non-steroidal anti-infective. So why? The reason why is because some medications work best at getting rid of some bacteria, some pathogens, and others work better on other pathogens. And I'm pretty sure both as a patient and a healthcare professional, we want to choose the first time the medication that's going to work the best. Okay? So this is very, very important. You got to know the pathogen before you can get a prescription for an infection. You cannot just assume, well, it's a bacterial infection. There you go. Okay, and that's why we have so many different brands and so many different formulations. And that's why they print out all of this information and put it in the little package. Okay, remember I said before about contraindications. Contra meaning opposite or against, and indications. Indications are the reason you would prescribe something. Contraindications are the reason you would not prescribe. This drug is not for people who have hypersensitivity to azithromycin, erythromycin, other macrolide, antibiotics, any component of the formulation, history of cholestatic jaundice. Who would know you can't have erythromycin if you have a history? That means I had it once before. I don't have it now, but I had it once before. Okay. Hepatic dysfunction. Anybody tell me what that is?
Liver failure.
Very good. Very good. We got a woman who knows what she's doing. See, now you're all going to have to study to keep up with Cindy. I'm just saying. But that's good. Make her your study partner. Okay. I just volunteered you, Cindy. You have the right to say no. Okay. So,
That's
very
fine. I lost my
important.
study partner this semester, so I'm open.
Very, very important. Again, both from a personal level and a professional level, that the contraindications are looked at. And you know why? I'll tell you why it's important from a personal level also. Because think about this. You had cholestatic jaundice. That's jaundice caused by your Cindy, cholestatic. You know, chole is bile. Okay, so
It's
your
your
gallbladder, right? There you go. Good job. All right. Now, you may have had cholestatic jaundice like 10 years ago. You haven't thought about it since. So when you're in the doctor's office with an infection, like an ear infection, if the doctor doesn't ask you, have you ever had jaundice caused by your gallbladder or liver failure? The doctor might not know that you should not have this prescription. So you got to back yourself up, because you know why? Because the patient is the one that suffers when human error on the part of the health professional happens. Okay. Now, I know that as coders, we are looking at the medical records after the fact. It's not like we could be reading through this and then quick call up the patient and say, oh my God, you shouldn't be. Okay. But it's something that might need your attention. And again, this may have more benefit to you on a personal side than it does on a professional side. But I'm a big believer in sharing knowledge, and this is important. Okay. All right, drug interactions. This is another thing that, again, you might forget to tell this doctor, okay? Especially if you or anyone you love is being cared for by multiple physicians, and maybe they each have prescribed something. True story, it happened to my father. He was in his 80s, and he, of course, had a cardiologist, he had a regular primary internist, and whatever. And they had each prescribed something different. So he was on, typical 85-year-old, he was on like 4 different medications. And something was amiss. I could tell by his behavior. So I started doing some research on his medications. And to make a long story short, I discovered that 2 of his medications, even though they were not diuretics, 2 of his medications had diuretic components. It was just an element, which ended up putting my father into dehydration, which is not uncommon for 85-year-olds. But so I found out about this. I spoke to his doctors and they changed his medication. And fortunately, we found out about it before it became too serious. Dehydration is a very, very serious condition, especially in the elderly. So here is another situation where you want to pay attention. And that website I gave you, drugs.com, I believe they have an interaction checker. So you can put in the drugs that you're taking or your loved one is taking, and it will tell you, oops, these two things should not go together. Or, okay, you're fine. All right. But again, you're sitting in the doctor's office. You're not necessarily thinking, oh, well, I have to tell him that my allergist has me on this and my whatever. Okay. Even though my doctor, and I'm sure that most doctors, or at least the nurse, when they're checking you in, you know how they ask you, well, what medications are you on? Well, I now, sadly, God, I'm at that point in my life where I'm on like 4 different medications. So now I typed up a list, and instead of taking all the bottles with me, but I make sure it's accurate. But you know what? Regular people who don't work in the business, who don't know these things, they think, oh, I'll remember. I take that pill every day. I'll remember. And then what happens? You don't remember. Okay. All right. There's going to be a section on adverse reactions. Now you'll notice that this says, for example, greater than 10% of the individuals taking azithromycin have gastrointestinal effects, as in diarrhea, which is less than or equal to 14% of these people, and then nausea, less than or equal to 7%. Now, another thing I want to caution you on is, if you're one person in 1,000 that has a bad reaction to something, that's 1%. But it doesn't matter that that's a very low number, because you're the one person who's having to deal with it. The biggest benefit of reviewing the adverse reactions is for you to know that if the patient who's taking the medication is starting to have chest pains and they never have before, it might be a reaction to the azithromycin. And I'm not telling you to stop taking it. No, I'm telling you to pick up the phone and call a doctor or call the medication hotline. Okay. So even though it might be 1% diaphoresis, who wants to tell me what that is? Sweating, sweating, sweating. Diaphoresis is sweating for no reason. Okay. This gives you what could possibly be related to the medication, and it needs to be investigated. I'm not saying it is. I'm not saying it isn't. I'm saying it needs to be investigated. Okay? All right. And then every pregnant woman or about to be pregnant woman, that I know that's not good English, but they don't let me teach English, so it's okay. All right. Azithromycin crosses the placenta. What does that tell you? Come on, you're all women. You should know what this means. It means you're getting the drug and the baby's getting the drug. Okay. So that means we do not take this unless we talk to the obstetrician and the pharmacist and whoever is, and again, this might be, well, I just peed on a stick and found out I'm pregnant, and now I have this sore throat or this earache, and so I went to the doctor. You're not thinking about telling the doctor you're pregnant. Maybe you might already have pregnancy brain. And nowadays, with COVID brain and pregnancy brain, you barely have a chance to have a straight thought. And COVID brain is real, by the way. But I just want to let you know, not an excuse for not doing your homework. just saying. All right. That's what I wanted to start you out with. Okay. So I want you to know that I am in the course, and in my email, my CCTC email, every day, 7 days a week, rain or shine, holiday or no holiday, I am in there checking. So you email me, you will get a response within 24 hours. Okay. If you do not get a response from me in 24 hours, it might mean that your email is not in my email box, but instead is in one of the rings of Saturn. You know that, right? 7 rings of Saturn. One of them, maybe 2 of them are emails. That's where lost luggage goes. You knew that. Okay. All right. We can email back and forth. We can make an appointment to speak on the phone. We can make an appointment to do a one-on-one Zoom, FaceTime, Skype. I'm very technically flexible. Okay. I'm here to support you whatever way is best for you so that you get out of here educated. And then when you get that third promotion and you're making $250,000 a year and they ask you to give a little speech to the staff, I want you to say, and you know what? Dr. Safian gave me some good advice. Okay? All right. Any questions? All right. We will, again, this is the one and only for pharmacology. I'm going to post the recording. If you want another one, if you guys have, you know, a question, something you want me to talk about, I'm happy to do it. I just don't want to give you that much more work. Okay. But I do want to see those discussions, and I want to see intelligence. Okay. And now that I know you guys,
Dr.
I'm going to
Safian,
expect, yes, Jacqueline.
I'm sorry, with the postings, are we only supposed to reply to you, or we're discussing this between each other?
You are discussing it with each other. You're going to reply to the original prompt. I love it when you reply to me, but you also want to reply to at least 2 other students for that week or that discussion.
Okay.
Okay. Good question. All right.
When do
Anybody
these
else?
start?
Huh?
When will these start?
Monday, last Monday, January 11th.
I'm not seeing it. I'll look again, but I wasn't
Go
seeing
under
anything.
discussions. Go under discussions. Click on
Okay, I will.
discussions and then scroll down. You'll see it. Okay.
Okay,
And if not, email me. No, actually,
I
if
will.
you can't find the discussion, I want you to contact technical support
Okay,
because I know they're there. I've already replied to several posts. Okay.
okay.
So
Yes.
you have to start a thread, and then you'll be able to see it. So that's something I don't know if you've
Right.
done.
You can
start
see.
the thread with?
You can see. There's a little button there that you click on. Okay. You'll
To
see my
start the thread.
question or the topic of discussion, and then you click a thread and post, and then you type in the little box. Okay. And again, our technical support people are really nice and very helpful. So if you can't figure it out, just they're there. They'll help you. Okay.
Do you have to start a thread to see the question?
No, the question is
Okay.
there. And then when you're ready, you start a thread and you type into the box what your answer is, and then you'll hit submit. And then you'll
Okay.
be able to see everybody else's threads also. Okay? Okay. Good questions. What else? All righty then. Have a wonderful evening. I'm so glad to be your teacher, and I'm here to help you, and stay safe and be well. Okay?
Okay.
Good evening.
Good evening.